Hey guys, hope you're doing well. Tonight I have my little sidekick Bubba here to help us out with the topic of discussion, which I think a lot of you will find helpful, hopefully at least. Right, bud? We're going to do a good job and answer some good questions tonight? Yeah, I think we are. So, tonight's topic of discussion will be really with the focus on how to present yourself as a responsible patient. And what I do want to clarify immediately when I say that is I am not going to give you some secret trick on how to present yourself as a responsible patient if you aren't one. um, my best tips and tricks for being heard as a patient and for being treated fairly and for being taken seriously and not being labeled a drug seeker are to do the following. Be a responsible patient, be a patient that can be and should be taken seriously, and don't be a drug seeker. I know that I'm making it sound extremely basic and a lot more simple than many of you think it actually is, and I think in some cases that's true, but in most cases it's not. And so tonight I'm just going to go over some points and give you some tips on how to make sure that you are presenting yourself in the best way possible because you're actually being a responsible patient. So again, just to reiterate the questions that I keep getting asked, it's like, Becky, I go to the emergency room, and how do I not get labeled a drug seeker? Well, again, Bubba, why are you making this so difficult? Okay, so when you go to the emergency room, if you don't want to be labeled a drug seeker, don't be a drug seeker. That's the first obvious answer, right? And I imagine that a lot of people that are writing into me are not actually drug seekers. That's why they're writing into me and saying, hey, I'm not actually a drug seeker, but I'm being labeled a drug seeker, and when I go to the emergency room, I'm not getting the help that I need. What do I do? How do I get the doctor to understand that I'm not full of crap, that I am actually experiencing some kind of trouble or some kind of pain, and I need some medical intervention because I'm going crazy and I can't sleep and I can't function and I don't know what to do? Well, let's just think for a second about why a doctor might think that someone is coming into the emergency room as a drug seeker. I think that when we think about things from this perspective, it's a lot easier for us to understand what we can do in a responsible way to help doctors understand what we're actually going through. That's in a way that's authentic and sincere. And again, I don't want to mislead anybody into thinking that I'm giving you tips or tricks on how to convince something that isn't there. I want you to actually be the type of patient that should be trusted in these situations. And so, what do I mean by that? So, what I mean by that is, first, let's talk about what the emergency room does and doesn't do, or should and shouldn't do. My mom I grew up in a household with a nurse of a mother who is a helicopter mom. But in addition to being a helicopter mom, she's actually also been extremely helpful in helping me understand how the healthcare system works prior to my career working in a healthcare profession for the last 12 years of my life. Ever since I graduated college, I've worked mostly in medical oncology, but worked in a lot of different specialties. But my career is based in working in hospital operations, so I definitely have an inside look on that. But like I said, a lot of what I know is based on my mother, who has worked in the emergency room as an ER nurse for somewhere around 40 years. And what she has explained to me over the years has been exactly what the emergency room is. And the emergency room is a place that you go when you are experiencing an emergency or you're experiencing a medical crisis or something that you basically can't resolve at home. You are in distress, and it's either one of two things. Either it's a situation that only the hospital intervention can fix or can help or should help or address, or you're in a situation where you're in distress and you aren't able to manage it for long enough where your doctor, or you can wait for your doctor to handle it the next morning when the office opens. So examples of this might be, something that might be a little bit less serious is you're experiencing a flare-up of a rheumatological condition, or you're experiencing severe back pain, or you have a really bad headache, or your blood pressure tanks, or whatever. There are plenty of reasons why someone would think that they should be going to the emergency room. And then there are, like much more true crises that like you have to go to the emergency room, where you like accidentally sawed your arm off, or you ate glass chips for dinner. I don't know, you do something nutty and you have to go to the emergency room because it's truly life or death. Either way, if you decide to go to the emergency room, it should be for a reason that the emergency room, for the purpose that the emergency room is going to take you from a place of, oh shit, I'm in a really bad situation and there's no other way for me to handle this other than to go to the emergency room, down to the place of, okay, this is manageable again. And manageable can be a very loose term. Manageable could mean, basically means stable. So there are two things that can happen if you go to the emergency room, obviously, right? If you go to the emergency room, you might be experiencing something that's so serious that the doctor will say, okay, like this is a problem. It is not safe for us to discharge you. We're going to admit you. We're getting you a bed, and we're going to continue to do a further workup to get you back to a more stable place so you can leave the hospital and be managed as an outpatient. That's the first scenario, and hopefully not the scenario that you end up in when you go to the hospital, because that's terrible. The second scenario is you're in distress and you're experiencing something that you can't manage at home with the medications that you have. You're really suffering, you're really struggling, and you have to go to the emergency room to get some kind of relief, right? So you go to the emergency room, and let's say it's some kind of pain, or even if you break something, you go to the emergency room. You're not going to be admitted for that usually. So you go to the emergency room, the hospital says, okay, you're dehydrated, we're going to give you fluids. Or you're really, really nauseous because you have the flu, and we're going to give you fluids and anti-nausea medication. Or you broke your arm, so we're going to take an x-ray, we're going to give you a cast. And all of those things, in most scenarios, unless, like I said, something more serious is going on, will result in them addressing the situation to a point where you are clinically stable, and they are going to give you a hearty high five, give you some discharge papers with clear instructions and guidance on how to move forward, and the expectation and the onus will be back on you as a patient to walk out of the emergency room, to be discharged from the hospital, and to take the next steps in your care. And so what that means, and what I'm implying by that, is obviously what a lot of what we do on my Instagram page is talk about people who are suffering with chronic illness, because I'm suffering from chronic illness, and that's sort of what I know. And the ER is not the place to be managing your chronic illness, or the regular day-to-day norms or symptoms that you experience as a result of being a chronically ill patient. So what I mean by that is, if you are someone who has a rheumatological condition, you should be seeing a rheumatologist on a regular basis. If you are someone, and whether it's diagnosed or not, if you are someone who experiences chronic back pain because you got in a car accident 3 years ago, you should not be going to the emergency room once a month because you have severe back pain. You should be establishing yourself with a pain management specialist as an outpatient who can come up with ways to treat the pain that you're experiencing. The reason I say this is because the more the greater lengths and the more effort you put into and go through to establish yourself as a responsible patient outside of the emergency room, the more likely you're going to be looked at as a responsible patient when you're in the emergency room. And really, more than that, what I mean by that is it does something really great, which is it shows that you are it shows the two different types of patient that you could potentially be in one body. And so that, by that I mean, when you establish yourself as this type of patient, you are the person that reaches out to specialists, and you go to your regularly scheduled doctor's appointments, and you take the medications you're supposed to be taking, and you do all the therapies that you're supposed to be taking, whether it's physical therapy or infusions or taking medication by mouth or diet or exercise or getting 9 hours of sleep every night or whatever it is. You are doing everything in your power to take care of your health, to prevent you from going to the emergency room, because ultimately, ideally, you don't want to go to the emergency room. Any patient that walks into the emergency room that seems super comfortable and comfortable to be there and looking like it's their intention to be there is obviously someone that's going to cause a red flag. Second, if you show that you are someone that has established yourself as a person who takes care of his or her health outside of the emergency room on a regular basis, without having to say much of anything at all, when you are in a true crisis and you end up in the emergency room, the doctor will be able to say, okay, you are this kind of patient who does A through Z, soup to nuts, everything under the sun that you could possibly do to maintain your health outside of the emergency room. I know that if you're standing in front of me right now, something is wrong, right? It's really, really easy to be able to send that message to the doctor without really saying anything. It's not about crying the most, and it's not about the faces that you make and, complaining and like being whiny and like putting on this act and this show. And I know that because for me, I am actually somebody that has a chronic problem, pun intended, of smiling. I am someone who, since I was a very young kid, has had a real big issue with expressing authentically that I am really suffering, because for whatever reason I smile a lot when I'm explaining whatever it is I have going on, and I don't know if it's because I am so used to being sick or if it's just because of my nature and how I interact with other people in general. But sometimes I think it can be a little bit misleading if I go to the doctor, or if I go to the emergency room and I'm explaining things in a way where I'm really holding the physical pain like over here during the discussion. But it's very rare that I'm looked at as someone that's a drug seeker, because in my discussions, I come across as a responsible patient. I come across as someone who's educated and knowledgeable about the condition that I have. I am thoughtful in expressing that I don't want to be there. And I am very clear in explaining to them what my life looks like outside of the emergency room. So, another thing for me that has definitely been in my favor over the years, what a cute little buggy he is. What has been in my favor over the years is that I have chosen a healthcare system in New York City where I live. And by chosen a healthcare system, I mean there are plenty of options in New York City of healthcare facilities that I can go to, emergency rooms that I can go to. I live down the block from 2 or 3 different emergency rooms. I actually choose one that's a little bit further because I respect it a little bit more. And I have chosen that health system because I like the care that I get as a patient. I feel like I'm heard. I feel like I'm advocated for. I feel like the clinicians that I meet with are knowledgeable and supportive and really care about me as a patient. And I like the general tone and the general mission that this healthcare system has for me as a chronically ill person. So I try to make sure that all of the doctors that I see, all the specialists, the rheumatologists, cardiology, GI, urology, whatever else it is, any kind of doctor that I need to see, I try to make sure that it stays within this healthcare system, because it will make my medical history completely transparent in the event that something were to go wrong. So, for example, when I just listed off all these different specialists that I see, it is very clear. Well, a few things are very clear. First of all, it's very clear that my condition causes a lot of different issues in my body that aren't so obvious. I have a rheumatological disorder, but it affects my eyes, it affects my heart, it affects my lungs, it affects my skin, it affects my stomach. Um, it affects a lot of things about me. And for someone that has a rare disease, an ER doctor might not know that. And most of the time, ER doctors or most doctors don't know what the disease that I have is. And rather than sitting there and explaining it to them in a hospital bed when I'm doubled over in pain because something's wrong, um, what better way to explain to a doctor exactly what's wrong with you clinically than for them to have access to your medical records at their fingertips, for them to browse through on their own time and to review in a clinical way, which also makes you a lot more credible, or what you would explain a lot more credible, because they could see that other doctors in the same healthcare system that they're working in, who are credible clinicians, are sort of vouching for the fact that all of these things exist to make you the patient that you are sitting in front of them in that moment. So it establishes that. It establishes the understanding and the knowledge that you are a very sick person. Number two, it also establishes that you are a responsible patient who seeks out medical attention for things that come up in your day-to-day life that need to be addressed in a non-urgent way. It shows that you have the ability to establish a rapport with clinicians. It shows that you have the ability to follow instructions. It shows that you take your health seriously. It shows that you know how to keep appointments. It shows a lot of things about you, without you having to walk into the emergency room and explain who you are as a patient. So I highly, highly recommend finding, hopefully you live in an area where this is possible. I know that electronic medical records are not the norm in every single place, in every single state and country in the world. Um, but at least in the United States, it is much more common, and in many states have mandated that we have that electronic medical records are available for patients. I know that was mandated in New York State 3 years ago. So establishing yourself as an outpatient is a huge way for a doctor to know when you walk into the ER that you are not walking in for any other reason but for the reason that you're walking in, which is because you are in distress and you need help. Because if you were really someone that wasn't taking care of your health, and your records show that you've gone to the ER 10 times in the last 2 months, or you have 5 different prescription for pain medications for 5 different doctors in the last 2 months, or it shows that you've been to 5 different emergency rooms in the last 2 months, you are the one that sets your own pattern and your own trail and your own sort of history that the doctor can draw his or her own conclusion on. And, I know that people are going to say, oh, but Becky, it's not the right of a doctor to judge a patient. Yeah, it kind of is. I mean, in the sense that, we are human beings and we should be treated as human beings. I get that and I can support that and whatever. But ultimately, at the end of the day, if you're going to the doctor, whether it's on an outpatient basis or in the emergency room, you have to understand that the doctor has a license that he or she has to preserve, and they're not going to want to blindly prescribe you pain medications over and over and over again if they have a weird feeling that something isn't right. Also, with the understanding that the emergency room is not the place to manage an ongoing problem, and you've been continuously told, go see a rheumatologist, go see a pain management specialist, go see an orthopedic doctor, you have a heart murmur, go see a cardiologist, whatever it is, you need to do those things. And if you continually ignore those things and you come to the ER once every few weeks or every week or a month or whatever it is, and you're not addressing those problems, you are bringing your credibility down less and less and less each time you walk into the emergency room. So I think, again, we need to take the responsibility as the patient and make sure that we are doing everything in our power outside of the emergency room to establish ourselves as responsible and proactive patients. So when we go into the emergency room, the doctor or nurse or whoever is evaluating us can say, okay, this person is for real, this is a real issue, let's help get this person back into tip-top shape, and then he or she will be on their way. And that's ultimately going to benefit you, because you're going to be able to really, if you take care of yourself outside of the emergency room, you also should not have to go to the emergency room and fight for that kind of treatment, because hopefully you'll be getting it on an outpatient basis, and the level of care that you'll be receiving will be more regular, and the way you feel will be more consistently positive anyway. So, there's all of that. I will say at the end of this that this is not what I'm saying is not 100% foolproof. I definitely have experienced in 32 years of being a chronically ill patient. I've definitely been discriminated against, and I've definitely met asshole doctors that didn't understand what they were looking at or who they were talking to. But that's just because people are human. You're not always going to get someone who's compassionate or empathetic or has had a good day. I mean, everybody's human. Every once in a while you're going to get a doctor who had a bad day before you walked in there. And no, it doesn't make it right, and it doesn't mean that you should be treated whatever way that you were treated if you perceived it to be a negative experience, but it doesn't change the fact or the reality that it's going to happen. So we need to do, again, knowing this information and knowing that all of these things are what's going through the doctor's mind when you go into the ER. You want to put yourself in a position where they don't have any room or as little room as possible to question who you are. And again, please don't misunderstand this as these are the behaviors that you need to express when you go into the emergency room, because the only behavior that you should have as a sick person walking into the emergency room is that you are truly sick. There is no act. There is no secret way of of leading a doctor to believe that you need something that you actually don't, because if you actually don't need it, you shouldn't be there in the first place. And I'm not going to sit here and give tips or tricks on how to get pain medication, because the only reason that you should be getting pain medication is because you're in enough pain where the doctor thinks it's warranted. So I hope you found this helpful. If you have any questions, feel free to DM me. But ultimately, at the end of the day, do what you can, do everything possible to make sure that your health care is managed as an outpatient. And when you go to the emergency room, when you're really in a crisis and you're really in distress, you will be putting yourself in a better position for a doctor to trust that that's what's actually happening. Have a good night.